Omwaka gw'2007 okwezi kwa mwenda, Dr. Rod Julius owaabire mukuru aha Chico Health Center ya Kana omuri disitulikiti ya Bundibugyo akaragurura endwara eyabaire eri akabi munonga kandi ayijirwe kumanya nka Ebola virus.
I happen to have been the in charge for Chico Health Center 4 in Bundibugyo district by then, and it is within the catchment population, the catchment area, where this event was being unfolded. But at that time, I was very inquisitive in surveillance, and I tried to dig behind, connecting dots of what actually was leading to these deaths.
Arikwijwe kubaruka kw'endwara egi, Dr. Julius nahijwe kutiina hamwe n'okuburaabura okwabire ku ruhu bwire kandi obwe barikucondoza aha ndwara egi. Abaabire bari abarwaire b'okubanza bakaba bariire enyama y'enkyende. Okukyebera okwokubanza kukakorwa mbiri y'enkyende kandi kwarugayo kurwire ekyareeseho okutandikwa kw'endwara erikumanywa nka Ebola Bundibugyo.
We had identified already that the first family that perished, 2 of their members were hunters, and they had come across a sick monkey which they captured with ease and took home. And it is from this that finally we came to realize that was the source of the infection, because we did recover the skin of the monkey from that family.
Okumanya endwara egyo kikiijaho n'ebizo byingi kandi obwire obwo abashaho bakaba tiine eki bakumanya kandi ekikutangaza abamwe abashaho bakafa okugira ngu okumanya obubonero obwire obwo kikaba kigumire kandi nk'oku Dr. Julius arikugira. Dr. Julius nayongyera agira ngu kikaba kiri ekyakabi munonga aha bakozi obwire obwo.
Abandi munibukire aliyendiire omutaahu wa Dr. Kuragurura oyuwakwa nayo mwasa kashanyu ticha okwetambira obulwera buno betu kenayo mubwa mutwalania mwesipatara ye Bundibugyo mushakolo Dr. Sesanga Kadu Steven nayo bwabwama bakula mwalwala betu asubulirayo n'abandi banyoni bayi bangahongaho.
Ahabwo omurimo gwiyabe nakora 2007, Dr. Julius akehayo okurebuka ngu yakuguka omu by'obushaho. Omuzamu yafuna degree y'obushaho ahari Mbarara University of Science and Technology kandi yagumizamu yafuna masters hamwe na PhD omuri public health omuri United Kingdom.
He moved on to read medicine and surgery from Mbarara University of Science and Technology. Then went to Roehampton University in the UK to do a Masters of Public Health. I just finished a PhD in Public Health.
Wanyuma y'okutendekwa akaba omukugu akaba natambura omu mahanga ga West Africa hamwe na Democratic Republic of Congo obwo arikuhweraho omu kubaruka kw'endwara ya Ebola.
And I have worked in a number of disease outbreaks, including the largest one, the West African Ebola outbreak, where over 11,000 people perished from this outbreak. And also in the DRC that has had a number of cases.
Ariko iso obukugu bweye akija amanya ngu Ebola nereetaho okufa kw'ebicweka by'omubiri ebirikureetera abarwaire bafa ahabw'okuburamizibwa okumara kandi omurwaire yarahuka kwikirira irwaro n'abaasa kutereera.
What kills in an Ebola patient, there are about 2 or 3 things. And the major one is that your organs will fail. Multi-organ failure. And one of the causes of that is the loss of the too much fluids that you will lose. Is one of the causes of your organs to shut down. When you develop shock, because your volumes have reduced, they eventually shut some of your organs, including your kidneys and the liver and the others.
Wenko mukugu akija amanya ngu endwara ya Ebola ine obubonero nk'ezindi ndwara kandi nk'abashaho baba batakinjire obubonero obu omurwaire n'abaasa kufa.
Individual virus, the symptoms, the signs and symptoms are similar to those of other diseases because they present with a high-grade fever, headache, and general body pains. They are progressive symptoms of vomiting, diarrhea, and hiccups. In our local language, we say shambeku.
yashaba abantu kwehara ebyombonano bwe batakozese kapiira kugira ngu Ebola nejanjara omu by'emibonano.
That Ebola can be spread through sex. And therefore, at this time, our colleagues who are involved in the sexual work need to be sensitized. It's also important to note that if someone suffers from Ebola, even when the person recovers, there are certain areas on the body, especially male survivors, that can keep the virus.
Yayongera yagira ngu Ebola neyo akabi munonga konka neebaasa kutambibwa obwe wahikirira abashaho kandi obwe orikuratira amateeka.
We should also prepare our communities that if you died from Ebola, this is a public health event. You will therefore be buried by a trained burial team. But it's important to note that a body that is already prepared for burial is not infectious, because the health workers know how to prepare that body. Once they put you, the dead body, into a body bag, you're done. That body will not spread, will not infect anybody else.
Eri nk'omunyamateeka kandi nk'omushaho Dr. Mandero Julius nagumizamu kuretaho akakwate ahagati y'amateeka hamwe n'obushaho okureebeka ngu Uganda yagira obuheereza burungi. Amakuru aga gashakwa Mate Isaac.